This is going to be a short video on what exactly you need to do to protect yourself this flu season and every flu season. And when I say flu season, I could also say I mean the pandemic, and I mean the pandemic before that. This is the last video in an 8-video series about all the information we have garnered, we have extracted from all the different countries around the world through the pandemic that had to help people that were showing up in their emergency rooms and their emergency departments around the world that either didn't want to use the vaccine or didn't have access to the vaccine. And I'm not even going into the vaccine, whether it was good or bad. I'm saying this was the alternative way, quote unquote, the non-vaccine way of helping people, because they had to help the people coming in that were struggling to survive. What could they do? All these studies and countries that collaborated with each other, from Scandinavia to the Middle East to Southeast Asia to South Africa to South America, as you will see briefly. Not going to go into the details, and I'm not going to go into the labs because I did that in previous videos. We're getting into what exactly you must do, a little bit of the why, and then the how, and have that be defined, and then where you can have access to these things should you want to. Okay? So let's get to it. So the 3 most important things you can do to protect yourself and others you care about this flu season or any flu season. And I want you to be thinking back to the last 3 or 4 years and people you may have had contact with and what your experience was in going through the lockdown, the shelter in place, and the pandemic, and what would it could have done differently, and how to use this information. Okay, putting together the critical factors that will protect you through every flu season. What do I mean by flu season? The pandemic, in essence, that we just lived through. But think of this as an analogy of taking a walk. Each year you're going to be hiking this mountain, and that's flu season. So I'm suggesting that you put in your pack the things you need to make that a successful hike. Flu season is something we all have to go through year after year. So why not be prepared? For anybody who's done backpacking, the whole idea of being prepared is a big deal. To have your stove and so on and so forth. You will rue the day if you don't have a nice sleeping pad where you ran out of gas. You will quickly remember to do that next time, okay? If you can't breathe, not much else matters. Anonymous ER physician. What we learned from COVID. Breathing is a balance between ACE1 and ACE2 receptors. ACE2 receptors open us up, let us breathe. They are immune supportive, they reduce oxidative stress, all the bad things. They are right there. And the first thing a virus does is shuts down those receptors. We heard all about that in COVID, but actually every viral respiratory infection does pretty much the same thing. Slightly different mechanism, but their strategy is knock it out, knock off that receptor, and therefore you just have regular ACE receptors, angiotensin converting enzyme receptors, that vasoconstrict, are pro-inflammatory, etc. All right, COVID was and is still all about the ratio between active, functioning ACE receptors and ACE2 receptors, primarily in the lungs. And that's what it looks like. So think of it as a seesaw. As you're getting sick, it's those ACE2 receptors are starting to be knocked off and being made dysfunctional. And so we have fewer and fewer of those, and we have a lot of these. We're very tilted in this side. We want to change that ratio back. Glutathione is required to protect your ACE2 receptors. It's going to be the thing that's going to bring it back for you. It's going to pull that back so you have enough ACE2 receptors, okay? So what is reduced glutathione is going to protect you against reactive oxygen species. So specifically, remember the thing called cytokine storm? That's the first thing. That's when you started to feel awful. You started at your first night of getting the flu, you couldn't sleep well, then maybe you went into body aches, then maybe you went into fever and chills, then you went into congestion. That was a cytokine storm. All that congestion was a cytokine storm down the back of your throat and into your lungs, and difficulty breathing, and it went on from there, depending on you. But reduced glutathione is the thing that's going to be the big pushback. It's your initial big barrier that you need to have enough of. So the SARS-CoV-2 virus, which is coronavirus, right, did the same thing. All these seasonal flu viral infections pretty much knock off the ACE2 receptors, and they start a cytokine storm. Reduced glutathione is going to reduce the exacerbated inflammation. It's going to reduce the cytokine storm. You need to have it. Know that. It's the fundamental thing to have. And this comes from an Italian study of 2020. So this isn't just glib little, hey, you just take this and you'll be better. This was hard earned, and many countries had to say, what is it we need? They came down to, especially a great Russian study that I've talked about a number of videos, is like they think this was the single most important deficiency in most people who died. who suffered the worst outcome of COVID was glutathione deficiency. We talked about that at length. Okay, so what is the glutathione gap? The glutathione gap is basically the amount of glutathione you have versus how much you need. How much do you need? What does that mean? It's relative to the cytokine storm. It's relative to oxidative stress. It's relative to reactive oxygen species. All that means the same thing. So if you are really suffering for whatever reason, you inhaled it, got exposed to it, you're weak, you're exhausted, you need a lot of glutathione. Don't you wish you had it inside you? But there's a way to get it inside you afterwards. And that didn't exist up till about 5 years ago. So when we go back and we look at past pandemics, what did we find? From 1918 to 1920, basically over 90% of the people who died were over age 50. Now the next pandemic of just a few years ago, we realized the same thing. It was over the age of 50. What is over the age of 50? It's severely reduced glutathione, and you can change that, and that couldn't have been changed before. So first, number one thing is sufficient glutathione is on your list. What will that do? That will decrease the ACE receptors and increase the ACE2 receptors. That's a big deal. It will fight back against the cytokine storm. It will reduce the reactive oxygen species, et cetera, et cetera. It is a big anti-inflammatory, big antioxidant, and so on. I'm going to leave it at that. Basically, it's going to reduce your COVID-19 severity and or death, right? Pretty straightforward. So glutathione will change your immune response. Low glutathione is not a big deal, but the difference now is low glutathione doesn't mean you got to roll over and die. Low glutathione means you need glutathione and you can get glutathione. That didn't exist before. So glutathione stimulates vitamin D regulatory and glucose metabolism genes, lowers oxidative stress and vitamin D, et cetera, a novel approach to treat vitamin D deficiency. We've been hearing a lot about vitamin D. Vitamin D is secondary. Glutathione deficient is primary. If you take all the vitamin D in the world and you have no glutathione, it's not gonna be very effective. You need both, but primarily you need glutathione first and vitamin D second. The role of glutathione in protection against severe inflammatory response triggered by COVID, 2020, 2018, 2020, Italian study. They have some of the best studies came out of Italy. All right, number two, remember there's three things. Number two is sufficient vitamin D. Vitamin D, same illustration, right? Sufficient vitamin D will change your immune response. First glutathione, second vitamin D. It will decrease your ACE receptors. It will increase your ACE2 receptors. It will be the anti-inflammatory, the antioxidant, and fight back on the cytokine storm. So you need to have both. So what happens? You're starting to feel lousy. You don't know what your vitamin D is. You don't know. It's like, what are you going to do? Start drinking down vitamin D or popping a lot of pills? Don't do that. Take some, of course, but it's going to be a slow help. It's not going to be that helpful for a few days. Glutathione, on the other hand, when we get to what you can take, will be dramatically beneficial when you take it. And that's the number one important thing to do. Think of all the people you knew through the pandemic that didn't do well. They would be night and day, night and day. I kid you not. Okay, vitamin D, you got that. How the presence or absence of vitamin D can affect COVID-19 disease progression. About the deficiency of vitamin D first. Vitamin D decreases 13% per decade of life. You go, well, if you're 20, not much to worry about. If you're 70, there's a lot to worry about. And in between, depends how you lived your life and your diet and so on and so forth. But this is pretty well established. This is 2022, just last year, came out of Tufts Medical School in Boston. So vitamin D in the older population, a consensus statement, et cetera, Endocrine, Journal of Endocrine. So please take this seriously. You need both. Number three, remember I said there's three things. Number three is fish oil, omega-3, which is EPA and DHA. It does a lot to support your immune system. And I've talked about this in these other videos. And I'll put a link above for all those videos so you can access them. But what I want you to know is this is part of the set. So again, if you're starting to feel terrible and you go, yes, you need to take some fish oil, but it's not going to help you feel better tomorrow or the next day. It's probably not going to help you for a week from now, but you need to do it anyway. It's glutathione is your top priority, vitamin D and fish oil. And take appropriate amounts. I'll show you some doses later that I take. I'm not here to tell you what to do. I'm not your doctor. I'm my doctor for me. So that's how I can share it with you. So what I want to not go through all these different things, though it is actually fascinating. So you can find out in this huge time on each study in 2022, a year ago, that's how important this is. A year ago, they said long COVID and long chain fatty acids, psychoneuroimmunology, implications of omega-3, long-chain fatty acids, and delayed consequences of COVID-19. Huge. So This is not a little thing, it's a big thing. This is a big deal. But what I want to show you is the ACE2 receptors. They're about that same seesaw. They're going to bring it back. They're going to increase the ACE2 receptors and decrease the ACE receptors. It's a big deal. Please do it. Please take it seriously. Long COVID has become a very big deal. People still have COVID now. Not so much by test. Of course, they have that, all the symptomology. So long COVID is quickly chronic fatigue. You know this, cognitive dysfunction. They can't think well. Still, depression, anxiety, post-traumatic stress disorder, PTSD, sleep disturbance, unresolved inflammation, psychosocial impact, long-term tissue damage. You bet. This is Taiwanese study, a different time. Yeah, same Taiwanese study, 2022. Another one out of Chile, another one out of Iran. In Chile, omega-3 index and clinical outcomes of severe COVID. Amazing. Out of Iran. So you have Southeast Asia, Middle East, and South America. Amazing. Notice US isn't in this one. Okay, so long COVID. So the question to ask is, do you feel lucky? From Dirty Harry, so to say. There is no certain endpoint to COVID. A lot of people didn't get over it. They still haven't gotten over it. And the symptomology is as it was when it started. Fatigue, shortness of breath, joint pain, chest pain, cough, smell, runny nose, eyes, taste, loss of taste, headache. Sputum production, of course, very, very mucousy. Sore throat, vertigo, muscle pain, diarrhea. And this is the UK Office of National Statistics tracked down more than 20,000 people who tested positive to determine how long their symptoms lasted. They now consider long COVID to be the persistence of symptoms for more than 4 weeks. So greater than 4 weeks is called long COVID. And there is no certain endpoint, meaning it can last for a very, very long time. That's a big deal. So what's the difference between COVID and long COVID in terms of symptomology? None. None. It's basically they're less intense. So what this is a percentage of the spectrum of post-COVID symptoms out of 1,200 and some odd people these are the people who had symptoms 4 weeks or less, and these are all the long COVID. Basically the same symptoms, yes, fewer people, but they still have it long after COVID is over. So it's a big deal. Long COVID is a big deal. And people still hurt, people still die from it. So after 12 weeks, many are still struggling. Here's what COVID looks like through your MRI. Onset of COVID, your lungs are full, all your ACE2 receptors. 6 weeks later, looks better. Now you have a lot of scar tissue. Now you have more scar tissue after 12 weeks, and it's still unresolved. Symptoms might take a long time to fade. A study followed up on people who had been hospitalized and found that even a month after being discharged, more than 70% were still reporting shortness of breath, and 13+% were still using oxygen at home. Still using oxygen at home. Oh my gosh. All right, so here's basically the flow of how it looks, right? So when it hits you, how it will go. First of all, the virus, you're exposed to the virus, and the virus loads. So what do you get? You get runny nose, headache, scratchy throat, body aches, inability to sleep. That first night is like, I couldn't sleep. Just didn't work. Sleep button, couldn't find the sleep button. So then it progresses, here's the arrow, then it's progressing to fever, shortness of breath, cough, extreme exhaustion. So virus is now replicating. Now it's starting to take hold. The cytokine storm is getting bigger and bigger. Now you're into a full-blown acute phase. You have no energy, you stay in bed or the sofa or wherever it is, and the symptoms are just getting worse. This is full-blown inflammation all over the place. Hopefully, something starts to change, and as you start to improve, your shortness of breath is still there, your cough is still there, your extreme exhaustion is still there, but it's all about your ability to respond to it, your glutathione, your vitamin D, your fish oil, a lot of other things, but these are the three big horses, the three big horsemen, if you will. So as resolves, not everybody gets better. Long COVID, people are still needing oxygen, as I just told you. Recovery for most, true, sleep improving, resolving cough, energy returning. And so how you deal with it is up to you. It is a big deal. If you know a few people that have this experience, you know that I'm telling you the truth and I'm talking to you. Long COVID, symptoms such as fatigue and difficulty exercising are common in people with long COVID and can persist for months after the infection. So what you can do about it, let's get to it. There again, you saw this before. Why glutathione is a problem. This is what it addresses, right? You're talking about how do I increase my ACE2 receptors. Here's that pathway, right? You start here, viral load, viral load, viral load. Some people nip it in the bud. Mild disease, 5-day resolution. They got a piece of cake. I had COVID and I'm over it. Well, good for you. You had the glutathione, the vitamin D, and you had a good immune system and support. Well, not everybody had that. Then you have the second group that gets over it in about 11 days. And then you have long COVID, which goes on forever. All right? So we have stage 1, early infection, stage 2, pneumonia, possibly. Stage 3 is acute respiratory distress, septic shock, and death is on the table for that. So severe COVID, what have we learned with the immunopathogenesis, a Brazilian study, 2020. I'm telling you, this is new stuff and it's very serious. Here's the slide that you should take home, print it, put it on your refrigerator, put it in your medicine chest. And this took a long time to put together, as you can well guess. So here's for the acute, as I say, glutathione, right? Glutathione, urgent care support. If you're in a hospital, you get IV, tell them IV glutathione, IV NAC, you need that. So in terms of home and an actual supplement, it's called liposomal glutathione. It's immediately usable. It has to be liposomal. It has to be reduced glutathione. I'll show you some products, but that's what it has to be. This didn't exist more than maybe 5 or 6 years ago. Liposomal glutathione. You use it for acute. As I say, you suddenly are feeling it. It's getting worse and worse. Take it, take it, take it. Okay, ongoing, you can take NAC. It's preventative, of course. Sorry for that. Yellow. And recovery. It's something you take. I feel it coming on, but it's not the immediate effect. NAC is more of a mucolytic. It breaks up the mucus and opens up the lung. So it's very helpful. It does, and it's a precursor for glutathione. So worst comes to worst, keep NAC in your medicine chest. That's better than nothing. Okay, so for the acute stage, preventative through the flu season, I would keep these handy because you can nip this in the bud just as you feel it. Pay attention to how you feel. So for ongoing, you're not acute, you're not thinking, you're saying, I'm in the flu season, but I haven't caught it yet. Have these things on hand. Be taking vitamin D, which is vitamin D3, K2, and it's usually accompanied by magnesium. And so now vitamin D is usually coupled already together with K2, so you don't have to worry about that part. Magnesium is something you have to take separately. There's many forms of magnesium. What I prefer at this time is magnesium citrate. So the citrate, because there's a chance that your uric acid will go up for a lot of people who have a propensity for that. Having a viral infection will put them over the edge and they may even get thrown into gout and other joint pain. So by having magnesium citrate, that's going to help that. But anyways, take magnesium, whatever you have. I prefer citrate. Zinc throat lozenges. This is the point. It's not that you're deficient in zinc. You need to take a lozenge that you suck on and let it dissolve in your mouth because think of a catcher's mitt. This is what you're doing. You're arming your ACE2 receptor. I kid you not. So you take that and that blocks it. That's a big deal. So ongoing, acute, and preventative recovery. So this is something that is easy to do, the zinc throat lozenges. So vitamin C. If you remember some of the other videos, vitamin C is what you do to really fight that cytokine storm. And you can just amp up. But now they have liposomal vitamin C, and that's immediately usable. Prior to, you just have to take a lot of vitamin C and just keep taking it and taking it. That's for the first part. After a couple of days, vitamin C is not going to be that useful. It's still useful, but it's the first part. Because for some people, taking too much vitamin C, as I've told you about the methylation and that aspect of the G6PD deficiency and all those and the whole malaria orientation in there, especially the G6PD deficiency people, they did not do well with a vitamin C IV or a lot of vitamin C because that's a pro-oxidant treatment. So it helps with that cytokine storm, but it also could suppress those people. So it's iffy in those cases. Talked a lot about that in previous videos. Put the link up above here for that. Okay, quercetin's another one. Quercetin's a big deal. Quercetin and vitamin C for that first part, the pro-oxidant to really get into it. So you increase the dose during acute. So the omega-3s, as you get your omega-3/6 ratio, if you're following your labs and you know what your ratios are great. I would say 4 to 1, 1 to 1 is what nobody has, but you need to get your ratios down of your 6 to 3. 3 to 1 or less is ideal. Preventative, 3 to 1 to less, preventative. If you don't know what your ratios are, forget it. So this is what I call the core of the antiviral squad. The glutathione, the NAC, the vitamin D3K2 with the magnesium citrate, the zinc throat lozenges, the vitamin C, liposomal, or whatever you can get your hands on, quercetin. Liposomal is really, there's only one company that's out there. It's not enough available. Just get some quercetin. And of course your omega-3s, and I'll show you some companies, but a lot of companies make a lot of good fish oil, a lot of good companies out there. So when I say ongoing, preventative recovery, start means when you start to think I'm feeling off, that's when you hit it with the glutathione, the liposomal glutathione. And if you think you've been exposed to it, take it preventatively. That's what I mean. So recovery, the glutathione, certainly the vitamin D and the fish oil, and you'll heal much more quickly. Okay, so glutathione is your front line of firefighters. Absolutely, without a doubt. This is the thing. Glutathione, NAC, and dosages. Glutathione, liposomal or S-acetyl. Liposomal actually has a number of different forms. Liposomal means it's quickly used by the body. S-acetyl is the more common form. Doesn't have to be that way, but liposomal. Remember, liposomal. Basically, you just chug this stuff, whether it's pill form or not. But to be more specific, liposomal, use 100 to 200 milligrams 4 times a day, ideally between meals. Or you're feeling lazy, just take it. Don't worry about between meals. But it just means you don't want the competition of having to digest food to get in the way of you absorbing liposomal, your glutathione. So when you're acute dosing, 1,000 to 2,000 milligrams throughout the day is needed. NAC, which is N-acetylcysteine, 600 milligrams 2 times per day between meals. Think about NAC, if you take too much, you can't take too much of this, you will get heartburn. I mean, you get a stomach burn that doesn't go away right away. These are some of the products. There's NAC, plenty of companies make NAC. Liposomal glutathione, different forms. One's capsule, one's not. And there's a number of good companies I'll show you about. So vitamin D, K2, magnesium citrate, know your levels. Have an idea of what you're in for, okay? Your goal should be to raise your vitamin D levels above 40 to 60 nanograms per microliters, or if you're in the UK, 100, 150 nanomoles per liter. To reduce the risk of infection, it is recommended that people at risk of influenza and or COVID-19 consider taking 10,000 IUs of vitamin D for a few weeks to rapidly raise the vitamin D concentrations. Don't go higher than 10,000 per day if you're feeling sick. It takes a while to rise up. Rapidly raise to concentrations followed by 5,000 IUs per day. So vitamin D, K2, 60 caps. To that, magnesium citrate, as I've talked about before. Do not blindly take vitamin D, but measure first. And make sure you are supporting adequate glutathione levels as previously covered in videos and as I talked about. So here we go. Here's what I use. Liposomal glutathione. I use both of these. I have NAC, obviously vitamin D. I have liposomal vitamin C, and this is actually liposomal vitamin C in elderberry. You would get this on Welevate. Welevate is the pharmacy that we use. It's the largest variety, and it's generally cheaper than anything else you can buy because there's such a volume going through. That's how it's cheaper. Okay, and you'll find out for yourself by comparing your own prices, no doubt. So this is how you would get there. So people say, where do I get this? This is where you get it. Done. They've really changed in the last 5 years. We've been able to encourage people to go through to use this pharmacy. Okay, of all of this that I've talked about, these are the studies that I think are the most profound, that if you really want to dig into it, go look at these particular studies. I've talked about a number of these studies on former videos about that, about how do we come to understanding glutathione, vitamin D, and fish oil. Why are they so important? That's how we found out about it. Okay, till next time. So if this is something that you're interested in, that is a topic that I obviously go deeper in terms of labs, in terms of how to do it, in terms of why you would want to do it, various topics, as you've seen that I've done in the past, then please let me know below in a comment. Till then.